In 2016, the IAFF partnered with Advanced Recovery Systems to design and establish a world-class facility that could treat the behavioral health concerns of IAFF members. The goal of the IAFF Center of Excellence for Behavioral Health Treatment and Recovery was simple: restore our brothers and sisters to wellness, and in the process, to return to the job. Today, we have many success stories, and we've learned that members, their families, local leadership, and other concerned parties have questions. What will the center be like? What types of treatments are offered? How much will this cost, and will my insurance cover the cost? This video will provide answers and hope. I encourage any member seeking help to take those first big steps to recovery. Stay safe out there.
Hello, I'm Kelly, a part of the team at the IAFF Center of Excellence for Behavioral Health Treatment and Recovery. The IAFF Center of Excellence is a one-of-a-kind treatment facility exclusively for IAFF members. With 64 beds, we are duly licensed to treat substance abuse and mental health. We specialize in the treatment of addiction, substance abuse, post-traumatic stress, complicated grief, anxiety, depression, and other related mental health issues. Our ability to treat these conditions together, all under one roof, makes us a unique resource for IAFF members across the country. Located in Upper Marlboro, Maryland, just outside Washington, D.C., the Center of Excellence is a safe haven for members to walk their path to recovery with others who have faced and overcome similar challenges. Our program was designed by Dr. Craig Katz of Mount Sinai Hospital, who designed treatment protocols for first responders in the aftermath of 9/11. Several treatment modalities are used at the Center of Excellence, including cognitive processing therapy, as well as individual, group, and family sessions. Meditation, along with art and yoga therapy, have also been highly effective for transformative healing. We've been honored to have helped hundreds of firefighters, paramedics, and dispatchers seek treatment, and for many, return home to their families and the jobs they care about deeply. From the beginning of the admissions process to the ceremony at the renewal plaza upon discharge, it is our goal to facilitate the highest level of quality care throughout a client's treatment experience. Let's take a look at a typical treatment journey. Step 1. A prospective client, family member, or fellow local or department member will reach out to the admissions department, which is available to help 24/7. We have dedicated intake coordinators for the Center of Excellence, trained specifically to address callers' needs and guide them through the admissions process. For some, especially union leaders, you may initiate this process by reaching out directly to our Center of Excellence Community Outreach team. The next step is insurance verification. At this time, our intake team will obtain a prospective client's or even an entire department's insurance information for a verification of benefits. This will be done through our in-house insurance department to determine coverage for our services at the Center of Excellence. Our center has in-network agreements with many commercial insurance providers, and we are constantly working to make treatment as accessible as possible. We are Joint Commission accredited and can also accept individuals whose insurance allows them to utilize out-of-network benefits, or those looking to pay privately for treatment. Once insurance information is collected, the admissions team will do an individual pre-assessment over the phone, which generally takes between 15 and 20 minutes. This is used by our in-house clinical team to screen existing substance abuse and mental health issues, other medical conditions, and any relevant family history that will determine if the Center of Excellence is the best fit for treatment. If the center is determined to be a viable option for the client, financial details will be addressed, including any existing copay or deductible that the member may be responsible for before or after their stay. Every individual's treatment experience is different, including the length of stay, level of care, and potential additional costs such as prescription needs that may arise. For those needing assistance with their financial obligations, we are able to set up incremental payment plans, and have also had many departments and locals use hardship funds to assist members in need, though this is solely at the discretion of the local itself. Our intake team is in continuous communication with both the client and the facility to determine the best method of arrival, whether by plane, train, or car. The Center of Excellence is convenient to Washington Dulles International Airport, Ronald Reagan Washington National Airport, and Baltimore Washington International Airport. A pickup will be coordinated by facility staff who will be on hand to greet and transport the client to the center. After arriving, they will meet with a member of the nursing team, and clients will see both a primary care physician, psychiatrist, and a financial counselor. Within the first few days of their stay, the client will meet with their assigned primary therapist for an assessment and undergo biopsychosocial counseling. This addresses the combination of biological, psychological, and social factors to determine the causes of their issues and the best solutions for success on their path to recovery. After initial assessments, the client is placed into the appropriate treatment track, either substance abuse or primary mental health, depending on diagnosed primary and co-occurring conditions. During their stay, clients will participate in both individual and group therapy sessions based on the appropriate level of care, ranging from acute medical detox to intensive outpatient treatment. Clients will reside in one of 4 station houses on the Center of Excellence campus. These are designed with firefighters in mind, set up much like the firehouse, and feature spacious living areas that connect multiple bedrooms per house. The center sits on a 15-acre campus and includes a state-of-the-art, fully equipped gym, which helps healing and recovery in a holistic sense. Depending on the season, clients are also encouraged to take advantage of our basketball and volleyball courts, as well as the scenic walking trails. Even at the start of the treatment stay, discharge planning will begin to ensure the success of the client throughout their recovery journey, at the center and beyond. 18 months of aftercare follow-up will be continuous and ongoing through various means of communication by the center's team, ensuring the client's success upon returning home and, in many cases, back to work. The recovery process does not end upon leaving the Center of Excellence. We are focused on creating sustainable, long-term success and are committed to connecting clients with medical and clinical professionals in their hometowns.
After treatment, once I got back, I was on light duty again until I get cleared by the department. And I actually kind of took it upon myself to start going around and hitting the stations and talking to people because this is such a big issue in the fire service: PTSD, addiction, depression.
One day, a brother or sister is going to come up to you and say, "Hey, I need help. You need a resource." They should have complete and total faith in this program and sending their brothers and sisters to it because it works.
There is hope. You can return to the job. I know many brothers and sisters that have returned to the job from serious substance abuse and PTSD issues. It's there. The resources are there to help us and to maintain us and keep us on the job.
We're truly here to help our communities and those that serve them thrive, and look forward to the opportunity to help members who may be struggling regain their lives, families, careers, and passions. For more information about the Center of Excellence, please call 888-674-2162.